We are now joined by Dr. Chris Pernell, Chief Strategic Integration and Health Equity Officer at University Hospital. Good to see you, Doctor.
Good to be here.
Doctor, do this for us. Define health equity, please.
Sure. So whenever I talk about health equity, I go according to the APHA, the American Public Health Association's definition, because I think it's spot on. It is the opportunity for all persons to reach the highest level of health, their highest and greatest potentials to be equity. It is an ambitious definition, but it is a definition that really puts health equity where it should be, aspirational.
You know, when we talk about health equity, a lot of talk as we do this program at the end of September 2020, it'll be seen after that. A lot of talk about these trials, these clinical trials. Where are we with the vaccines? The number of Black and brown Americans who are included in those trials is disproportionately too low, while the number of cases of COVID for those who fall into that same category is way too high. It's a health equity issue, is it not?
Yes, it is. It's spot on. I tell people we have decades worth of health disparities research and literature that tried to describe and, let's say, paint the severity of the issue around health equity for folks. But I think we've learned more as a nation in these past 6 months by the destructiveness of this coronavirus pandemic and how Black and brown communities have been disproportionately impacted. I don't think it's possible for anyone to deny the barriers that exist to reaching the full potential of health for all persons. What we've seen is, as a friend of mine, good friend, describes, those fissures in societies became earthquakes, and that's where we're seeing the devastating impact of.
So as our team puts up the Confronting Racism, a long-standing series that we are committed to doing, I'm not even going to say how long, because the fight will continue. So as we put this under the category of Confronting Racism, talk to us, Dr. Pernell, about why the issues you just described are, in fact, issues of institutional and structural racism.
Great question. So I like Dr. Cameron Jones's definition of racism, and I want to start there. She is a leading thinker in preventive and public health medicine. And so Dr. Jones describes racism as a system of structuring opportunity whereby one group is advantaged and another group is disadvantaged based on phenotypic differences, meaning what they look like, but the strength of the society as a whole is sapped. So if we understand racism is actually system sickness, and that system sickness impacts what we call the social determinants of health, right? So that system sickness impacts where groups live. If you could think about historically about redlining, right? Certain impoverished, disenfranchised geographic regions where Black and other communities of color were actually forced into by being locked out of economic opportunity. If we think about the substandard housing that Blacks and browns live in poorer communities, if we think about that crowded housing, if we think about where folks work. There was a recent article that posted by a researcher out at UCLA that cited U.S. Census data that said that Blacks and Latinos comprise approximately 43% of the service and production industry, right? So those are those essential workers working in frontline positions where they did not have the luxury or the privilege to work from home, right? Because of the
like
nature
me, I'm working from home. I'm broadcasting from home.
Yes.
Not everyone has that.
Not everyone has that. And how I describe it is, households under threat, right? When I say under threat, under economic threat, loss of income is destabilizing. It's destabilizing, I should say. So that's how system sickness, also known as structural racism, impacts health outcomes, because it impacts the type of job you work. It impacts the wage you earn. It impacts the type of housing that you live in. It impacts what your neighborhood looks like, whether you have clean air or whether you have sidewalks that are walkable. There are so many things that are tied into the outcomes that we see. And it's not until we have those conversations about those upstream factors can we really get at solutioning.
But a couple of things. Check out our previous interviews with Dr. Sharif El-Nahal, the CEO at University Hospital, one of our healthcare and hospital partners, and also a series of interviews we've done with one of our board members, Micheline Davis, up at RWJ Barnabas Health. We talk about social determinants of health. But let me ask you this. By the way, this is personal for you, doctor, is it not?
Definitely personal. So unfortunately, I lost my dad to this pandemic on April 13th. My dad
I'm very sorry.
Thank you, Steve. My dad was a hero to so many, right? Because he was a young Black man coming up in the Jim Crow South. My dad got a position at the famous Bell Labs, but he got a position on the grounds crew. But because of his tenacity and others recognizing talent within him, he ascended the research throne and became a member of technical staff, which was reserved for PhD scientists. So my father was this man who lived a life of defying the odds, lots of chronic health conditions, and he couldn't escape the pandemic, right? He got exposed and his body just could not fight it. And in addition to losing my dad to coronavirus, my oldest sister, who is a breast cancer survivor, she too got infected. And just think about it, Steve. My dad died on the 13th of April. We had a virtual service for him toward the end of the month. The day that we had the virtual service for my dad, I believe is when my sister found out that she was positive. And she's been going through a very long and harrowing battle trying to overcome. So this is definitely personal for me. And when people say how coronavirus or COVID-19 has disproportionately impacted Black and brown lives, I like to use myself as an example. 2 people in my family infected, 1 died, and 1 a long hauler trying to overcome.
You know, I'm going to let you do this in the last minute we have. We're doing this before the November 3rd election. This isn't about politics. It's not about the election. As we do this program, 200,000 people have died, including your dad. President Trump recently said in a speech, virtually no one has been affected.
That's so hard to hear. It's actually infuriating. It's disrespectful to the humanity of those Americans who've lost their lives. Look, we've lost more Americans than we've lost in every world war other than World War II or the American Civil War. That is a staggering number, and that is something that the president and no one can escape. And the fact that we have those in government, especially at the federal level, who can be dismissive as if these lives don't matter, as if these lives hold less dignity, it's atrocious. And I think it's put a greater fire in my belly to make sure people understand, how do you truly achieve health? You achieve health by voting. You achieve health by those social determinants of health that we described previously. So this is a personal fight, and I'm going to keep telling it, and I'm going to keep impressing upon our community and all communities the need to be informed, educated, and involved.
Dr. Chris Pernell from University Hospital, I cannot thank you enough. And by the way, for anyone watching right now who's asking or wondering, why would Adubato even raise that quote? Don't know what's going to happen in the election. You'll see this after. It's because people who are in public life, whether you agree with them or not, they influence our view of important, critical life and death issues like COVID. That's why. Thank you, Dr. Pernell. We appreciate you joining us, and we wish you and your family all the best. I'm Steve Adubato. We'll see you next time.
State of Affairs with Steve Adubato is a production of the Caucus Educational Corporation. Funding has been provided by the Northward Center, PSC&G, the Robert Wood Johnson Foundation, the Healthcare Foundation of New Jersey, Johnson & Johnson, MD Advantage Insurance Company, the Russell Berry Foundation, the Adler Aphasia Center, and by NJ Best. Promotional support provided by NJ On Air, and by CIANJ and Commerce Magazine.
What is your child's dream for the future? Doctor? Teacher? Architect? Whatever they aspire to be, a college education may realize those dreams. And NJ Best can help. It's the college savings plan specifically designed for New Jersey families. Start saving today with as little as $25, because now is the time to invest in their future. To learn about NJ Best 529 College Savings Plan, its investment objectives, risks, and costs, read the Investor Handbook available at njbest.com.